Well, hello, everyone. My name is Josephine Akingbulu, and I would like to welcome you to the Autism Intervention Research Network on Physical Health. This is our September 2022 webinar. Thank you all for joining us today. Because of the number of participants, your audio will be muted throughout the call. However, you can submit questions at any point during the presentation via the Q&A feature or in the chat box on your webinar console. Just as a friendly reminder to please be respectful when communicating in the chat and asking questions. And do note that only questions or comments pertaining to the presentation will be addressed. This entire webinar is being recorded and will be available on the AIRP website, which I will put in the chat. And you may also view the presenter slides to follow the presentation on our Google Drive archive, which will also be put in the chat. There will be a short evaluation survey at the close of the webinar, so we invite you to provide feedback on this webinar and also to provide suggestions for any future webinars. So for the interest of time, let's go ahead and get started. We first want to acknowledge the health resources. Next slide, please. The Health Resources and Services Administration as the funding source for the AIRP. Screen there. Now, it is my honor to introduce our presenter for today, Dr. Denise M. Nunez, MD, MPH. Dr. Nunez is a preventive medicine physician from UCLA. Her work with the neurodiverse population stems from her fellowship training as a leadership in neurodevelopmental disabilities. This is the LEND program graduate. During her training, she explored the challenges of pregnant persons with autism spectrum development experience during pre and postnatal periods. She continued her work at UCLA's LEND Clinic, where she advocates for the best outcomes for all patients and explores ways to improve patient care. So please join me in welcoming Dr. Denise Nunez.
Hello, everyone. So wonderful to see you all here. It's my pleasure to be with you. Thank you for the wonderful introduction. So I'll go ahead and get started. So again, it's a pleasure to be here to discuss with you sensory inclusive clinical spaces. This is an overview of what I will be sharing with you today. First, we'll reflect on the typical clinical environment and why it's interfering with taking care of our patients. Then I'll present a case study of a hospital who did an amazing job tackling the matter of sensory sensitivity in their emergency room and in their hospital system. I will then discuss how we can apply the lessons that they learned to the outpatient space. And later, I'll share a few tools and tips on how to apply sensory considerations and the benefits to be derived for our patients and for patient care. So this framework is really directed towards providers, but if you're a patient or someone with sensory sensitivity, you can also use some of this information to make your clinical experiences a little more comfortable and discuss with your provider so we can work as a team to expand this message and improve patient care. Overall, I plan to give you the basics of how to support our patients with sensory sensitivity and show you how simple changes can change everything. So please take a moment and think about all patients across the world currently seeking clinical support. Where are they? Most likely they're in a clinic or in a hospital to receive care. So what do these spaces usually look like? Think about the last time you visited one of these locations. So imagine a clinic or hospital and think about, what are you seeing? What are you hearing? Are you perceiving any specific smells? Are you noticing any kinds of surfaces coming in contact with your skin? And do you happen to be tasting anything? Sometimes people can sense tastes in the air or feel a sense of taste that's quite strong in a certain environment. So did any of that happen to you the last time you went to a clinic or hospital? Here's a visual to support your potential memory exercise. This is a typical waiting room for a busy clinic. As you can imagine, if you have not thought of this before, this wonderful location doing its best to take care of as many patients as possible can be a source of multiple challenges for our sensory sensitive patients. So take a moment, look at this picture, access your memory of your previous experiences, and think about what challenges a patient with sensory sensitivity may experience here, or if you have them, then you know them quite well, so keep those in mind. Overall, we can certainly agree, I believe, that in most cases, our clinical spaces are flooded with bright light, bubbling with activity and bubbling with sound. They are busy, noisy, and bright. For patients who are feeling sick, having abdominal pain, migraines, nausea, etc., this environment negatively contributes to how they're feeling and most likely makes it worse. But for our patients with sensory sensitivity, their processing of this busy, noisy, bright, it's disruptive and can be detrimental to them and can be the very thing that stops them from getting medical care. So sensory sensitivity is just as it sounds. It's an individual, if you haven't heard of this term officially, who's sensitive to their environment. They process sensory stimuli more strongly than others do. An example is a person who may feel pain or even nausea when exposed to loud sounds. So sounds can actually cause physical manifestations that are quite uncomfortable and difficult to control. During periods of illness, these sensitivities may get worse. And so it's important in the medical system and in healthcare systems that we keep these in mind. And so here we have some definitions. Sensory sensitivity is also known as sensory processing sensitivity or environmental sensitivity. And it's important to note that it is a biologically based trait. So it's something that an individual can't necessarily control. It's part of the way they process the world. It's part of the way they developed when they were developing as children. And so it's something that should be factored into medical care. Some people can consider themselves a highly sensitive person to environment. So I wanted to provide some of the definitions here for those who haven't heard of an official definition before, or if this is a new concept for you. So when thinking about patients with sensory sensitivity, people may think of a person or child with autism spectrum tendencies. This list is just a few examples of health conditions which are also associated with sensory sensitivity, which are quite variable. If you take a look at these different conditions, if most of us lucky enough to live a long, full life, we may eventually have a condition that leads to sensory sensitivity, or we may already have sensory sensitivity. This can also change over time, as I mentioned before, with illness aggravating some of these sensitivities or actually starting with some of these illness states. Some states can actually make it more prominent, such as pregnancy. So it's important not to determine this as a static defined state, to continually check in with patients about this as needed. And if you have sensory sensitivities, understanding that that can also change over time with the way that you process and the way that certain conditions may impact you. So looking at this list, I'm just pulling out a few examples. Having a concussion can make you sensory sensitive. Having potential hearing loss can make you sensory sensitive as well. Some pain disorders can clearly or understandably make you more sensitive to certain textures, touch, sounds, and such. So I just wanted to extend the knowledge that this goes beyond our current topic at hand. Our sensory-rich clinical spaces do challenge our patients, and some of them have incredible resistance to seeking care. Studies have shown that these environments can be a barrier to healthcare. And here are a few quotes about what some patients with sensory sensitivity say about their healthcare experiences. For example, fear, anxiety, embarrassment, or frustration keeps me from getting primary care. Or, for example, my behaviors are misinterpreted by my provider or staff. So this can be someone who is responding very strongly to bright lights or sound, and it's not really understood that this is a way that they are managing and trying to disperse the discomfort. Additionally, and unfortunately, 30% of patients in a national survey say that the clinical environment actually contributes or exacerbates their sensitivities. So they can come into a hospital or come into a clinic, not have any sensory sensitivity experience at the moment, but once they enter the clinical environment, they actually start to experience those sensations, which is something we generally need to work on, in my opinion. So another big point for reviewing this and thinking about this is that ignoring the needs of our sensory sensitive patients really is not an option. If we only look at a small group of patients with sensory sensitivity, such as some of the patients with autism spectrum, according to the CDC, the prevalence of autism spectrum has increased from 1 in 90 children to 1 in 44 children as of last year. And since our patients with autism spectrum may have other conditions, they tend to use medical services more often than other patients. And it's also estimated that between 30 to 90% of patients may have sensory sensitivities, depending on the age group that we're looking at for those with autism spectrum. In addition, we're opening our patient care centers after COVID-related restrictions. So we have patients that have been getting all their medical care at home. They have not been triggered by the clinical environment during their care with remote services. So as they return, it's likely that our more sensory sensitive patients will experience exacerbations and discomfort when interfacing with the clinical environment. I also invite us to consider our management for patients with physical challenges, such as those who require ambulation supports, like placements of handlebars and ramps, and how much we attend to that. And sensory sensitivity should be given the same considerations as best as we possibly can, because just as a physical matter can interfere with your ability to go see a doctor, a sensory matter can also interfere. So let's discuss how to create sensory inclusive clinical spaces. I'll start our journey in the emergency room. This is a clinical space that has been the most effective at tackling this issue nationwide. Since in an emergency room, they have to navigate challenges of new patients every shift, patients that they are not familiar with, and they have encountered some issues with this. So I'll present some lessons learned in the Children's Hospital of Alabama system. So at Children's Hospital of Alabama, Birmingham, they noted that their children who had autism spectrum tendencies tended to run into more trouble from what they noticed in the ED with discomfort, with irritation, and families seemed to be more frustrated with the way that the medical system was interacting with their children. They also had concerns of agitated patients and stressed medical staff. So they created a task force to investigate, how do we solve this matter? There has to be a way to improve our patient care in this sensitive environment. So they grabbed a group of families, asked them to volunteer to be interviewed and to explain their experiences and to explore potential solutions and make recommendations. The collective of knowledge led to trainings, which I'll discuss further ahead. This collective also led to planning environmental changes in the hospital to reduce those identified challenges. So the first thing they did was to apply environmental modifications. And these were purpose resulting from the task force, and they're listed here on the slide. So firstly, they changed their blank yellowing walls full of aging notices, full of overwhelming potential equipment lined up against the walls. And they changed the color of the walls to a calming paint color, the soothing blue. And it seems like blue is the most popular color for causing soothing kinds of sensations or interpretations for your patients and in their environment. They also asked children at local schools to create artwork that they believe would help sick kids feel better. And they framed these images and just placed a few in different rooms and allowed a lot of space around these images so that individuals' eyes can rest. So it wasn't a large collective or exhibit of different artworks of children. It was placed strategically throughout the patient rooms. Now, if you've ever been to an emergency room, you know there are constant blips, beeps, sound, noise, alerts within the patient rooms and across patient rooms, in the hallways, in the nurse's station. So here at the hospital, what they did was they eliminated all of the alarms within the rooms, and they only allowed for noises and alerts to be sent to the nursing stations to reduce noise. Additionally, they changed the lights in the patient care rooms. So they previously had the glare of fluorescent tubes overhead, which can be quite irritating. I don't think anyone really likes those fluorescent tubes at all. And they were replaced with LED bulbs with dimmers, so they can modify the light to accommodate each patient as needed. Additionally, they had a sensory cart, which was built with supportive tools and stocked with supportive tools, which I'll describe a little bit in detail later. This cart would be driven around to each room to share with patients in need. The final point here is that, as noted in the patient interviews, we as medical providers rely too much on our verbal abilities to explain. Many patients are visual learners or would benefit from visualizing. So they created visual charts of common procedures to help explain these procedures more effectively. And so here are some pictures of the Children's Hospital of Alabama, Birmingham, reflecting the applied changes. So on the left, there's a picture of a walkway, the entrance to the emergency room. Here's the soothing blue. They added blue to the different pillars, to the walkway. And so that as someone enters the emergency room, it's not this glaring, overwhelming, scary experience that it already is, adding to it. Also note the dim lighting leading to the entrance. This hallway is also an area where patients and families can take a break from the emergency room if they need it as well. On the right side, there's a picture of the inside of the emergency room. There's just a slight peek into one of the patient rooms on the left side. So you can see the blue wall with a little bit of teal on the base. The wall is mainly blank from what we can see. They also removed extra equipment to reduce clutter and having patients feel overwhelmed. So after environmental modifications, another step in their work was to train their staff. Since the focus was on improving clinical care specifically for children with autism spectrum, they had a component of the training dedicated to enriching provider knowledge. They also emphasized modifications recommended for communicating and methods of approaching patients. The major key that they emphasized was to ensure that all staff knew to ask about sensory sensitivities and to factor that into the patient encounter as much as possible. So after the environmental modifications and the trainings, the main goal was to identify sensory sensitive patients early. So they created a workflow to support the identification of a patient prior to admitting them to the emergency room. So the first step was signs like, as you see in this slide, they had signs that indicated that they're autism and sensory friendly. Then they created a sensory pathway for that identification, which I'll show you in the next slide. So first, when a patient or a patient's family goes into the emergency room, a triage nurse, which is going to ask questions about health, ask and determine if this is a high-level emergency or a low-level emergency. This is what a triage nurse does. Also asks for sensory sensitivity diagnoses. If a parent or a patient says, yes, they do have sensory sensitivity, they will not be sent to the waiting room. They will be given a bed and an isolated room, meaning a room that is further away from all of the emergency room activity as possible. And while the family or patient is waiting in the room, they're given a survey to fill out to ask them about specific sensory sensitivities and plans on how to address them. And so this is the summarized workflow for their early identification. Parents described relief in this process applied, and filling out the survey empowered providers to be better prepared to engage the patient. So next, I'll share an example of how a patient prompted sensory modifications to improve their clinical experience. So this example occurred during the transition to sensory sensitive implementation. There was a nurse who was managing the case who had trained in this practice, and the physician was a per diem, so only hired per day to manage the emergency room and didn't receive the trainings yet. So the patient that they saw was nonverbal and considered not high functioning. He came in with a caregiver from a group home, and the physician who saw him wanted a chest x-ray, but he really had a hard time examining the patient. The physician approached the boy in a typical way, tried to interview him, tried to interview the caregiver, and then do a physical exam that did not go very well. When the radiologist arrived to take the child for x-ray, which usually has to happen in a different room, he held the boy's arm and said, all right, come with me to the x-ray room. At this point, the child had a meltdown. He obviously did not know what was going on. So the nurse who had this training said, let me go speak to the patient and the caregiver, went down and talked to the child and the caregiver and understood he's nonverbal, but he knows that that means he can still understand. So he tried to find out better what his sensitivities were. The nurse learned that the child's sensitivities were sound and touch. So the nurse told the child, the doctors want to do some things to make sure you're healthy. He asked the boy if he wanted to go home, and the boy nodded. So the nurse explained, the doctors are going to come in and take a picture with a big camera. They're going to take a picture of your belly. And after they take that picture, then you can go home. And the boy nodded his head again. So the nurse got the radiology technician to bring a portable X-ray machine. A portable X-ray machine is not as effective as the X-ray machines that you take a patient to, but it's still very effective. So they arranged for the doctor to agree, and the doctor agreed to do a portable X-ray so they can bring that X-ray machine into the room, and that allowed for the patient's caregiver to be present. And it was better than taking him to another room that is cold and loud and that he's not familiar with. They brought in the portable machine, they took the picture, and they left, and the child was more comfortable. They were able to assess the patient, and they were able to move forward. So, and this also allowed the boy to understand what was expected of him and what was going to happen. So in applying these changes, patient care interactions improved at this hospital, and it led to application in the adult emergency room and also throughout the hospital. They also found that patients came from other areas just to receive care within this new framework. And the staff who was sometimes having issues or having doubts about how to manage things felt more comfortable in doing so now that they had knowledge about sensory sensitivities and how to more successfully address them. I hope you found that ER case helpful. So next, I'll discuss how to apply these concepts and lessons learned to an outpatient clinic and give you some tools on how to create sensory inclusive clinical spaces. So recall the image we reflected on in the beginning of this talk. Healthy, thriving clinics have very similar challenges to the emergency room. Excessive visuals, excessive sounds, or even challenges to basic human needs like needing to eat, needing to sleep, needing to void, or go to the bathroom, in other words, can all be triggers and can easily exist in the clinical setting. So here are a list of sensory-friendly solutions, which I'll discuss moving forward in further detail. But take a moment to review the simplicity of this list. It's really empowering, and I hope it empowers you to feel more confident to apply these solutions at your clinical practice. And if you're a patient, to know there are some ways to make yourself more comfortable if you have sensory sensitivity. So just review the simple and happy messages here on the sensory-friendly solutions recommendations. And I'll talk about how to apply them moving forward. So firstly, one of the most obvious challenges of the clinical space is a lot of noise. It's excess sound. So reduce noise. Everybody shut up, right? No, it's easier said than done. You've got babies that have to cry. You have kids that have their moments. You have nurses that maybe have to shout over to help have someone hear them better. And so it's easier said than done. So it's better to use tools that will help to make it possible. So if you have a clinic that's blessed with a large area, you can consider creating a separate waiting room for those who prefer less sound. If you don't have a large enough space to create two separate waiting rooms, you can create certain quiet zones where people can sit if they want to be more quiet. If you're not able to do that, or in addition to that, you can provide earphones or earplugs. And earplugs are a few cents on the dollar for a pack of 30, a pack of 50, and they can be a relief to those sensitive to abrupt or loud sounds. Another thing you can do is provide a sensory-friendly map, especially if your clinic or area of service is quite large, and you can have the map show patients where they can expect more sounds, more noise, and also where it's quiet so they can seek respite. So if they know they're going into a more noisy area, they can seek those earplugs or have their own headphones so they can also help to feel more comfortable during those periods if sounds cannot be reduced. And finally, I think one of the most cost-effective and effective solutions is to allow a patient to wait in the car till they're ready to be roomed if they've come in a car. Of course, if they haven't, they don't have access to this solution. But if they have a car, they can wait and they can be texted or called at the time that it's their turn to be seen. And they can even enter Hollywood style, as UCLA, I suppose, that we're in LA, through the back, bypassing the waiting room if possible or if helpful. Clinics can also have those blinding fluorescent lights that I mentioned that were uncomfortable and change in the emergency room, and they can be in various places in the clinic. If you have already a window with natural lighting, this has been found to be the most helpful with those with sensory sensitivities to light. Also, you can have dimmable lights if possible, or even lamps that can be switched on and off in different areas of the waiting room or in different areas of the clinic. That can also help for those who are very sensitive to bright light. A bathroom is essential, and so those who do not have supports or access to a bathroom can cause serious challenges. So make sure that in your clinic, bathrooms are accessible and hopefully have the ability to serve multiple patients. So I'm saying more than one restroom here if possible. Of course, no one is expecting you to build a brand new bathroom or anything like that. So, use what you have. But also in the restrooms, if there's an option for dimmable light, that could be helpful because this can be a place where people can take a break from high sensory environments. Some parents generally take their children to a restroom to isolate and calm them if they're feeling overstimulated. For some lucky clinics, they may even have a whole room designated for taking a break and isolating from large groups if needed. And this is not accessible to every clinic, so not something that has to be designed if that's not already available. Another basic human need is food, of course, especially if children are hungry, thirsty, and have irritability. It can cause an issue that's easy to solve for some patients. Having a few snacks on hand and a source of water can be key to help some patients. And it also does help hungry and thirsty and busy caregivers who may benefit from having a snack if they haven't eaten all day while they're taking care of their beloved that they're escorting to the clinic. Make sure that you welcome caregivers and let them know what resources are available to assist with sensory sensitivity. They may be busy and overwhelmed themselves and they have no idea that there are all these other resources. There's snacks, there's access to the bathroom, there's a way to dim the light, there's an area for them to, take a break and have a quiet moment. So you can consider discussing that with them, having a handout or having something on the wall that indicates that those supports are there for them and their patients and their beloved ones. As mentioned in previous studies, we rely too much on our ability to explain verbally. So making sure that we have clear, concise instructions with supportive visual tools can be key to any visit, especially if there are stressful procedures involved. Something like a vaccination, sometimes even a throat swab can be very stressful for some patients. You can also consider providing images and explanations of procedures even before the visit, maybe long before the visit, if this will help your patient out. If your parent for the child considers it helpful in preparing them or even for the adult. Another great tool that is an excellent piece of toolkit, an excellent piece for your toolkit is to provide sensory-friendly appointments. And this is welcome for patients of all ages. So what you do is you select times during clinical encounter where there is less patient density. So there are less patients scheduled, usually early in the morning or later in the evening. But later in the evening can be busy for certain clinics. So depending on what your scheduling is, select those times. And during that time, you can schedule your appointments specific for patients who have sensory sensitivity. You can also provide extra sensory supports during those visits, like dimming the lights more in the waiting room, no music. If you have overhead music, you can turn it off at that time. And then if you're seeing children, you can provide more sensory toys available. But at that time and at any time, you can ask parents or patients to bring their own tools to help them with the visit. These visits can be a great success to reduce the barrier for care in adult patients as well. As the previous research that I worked on experiences of pregnant mothers with sensory sensitivity demonstrated that mothers preferred coming in during the times where there were hardly other patients, so they could be free from strangers bombarding them with questions about how many weeks are you, and trying to touch their belly, and is it a boy or a girl? Like sometimes they just need a little moment before their appointment, and so just having less potential for that can really help them feel more comfortable. Providers should also consider that the visits during this time may be longer, since modifications may be required. So consider adding extra time to those visits. Here are some additional considerations for adults in the outpatient setting. As seen in the process with the emergency room, you might consider placing a sign about sensory sensitivity and the knowledge of that, and welcoming, endorsing that, and potentially providing a survey for patients to review their sensory sensitivities. Some patients that I spoke to really appreciated having a separate room, one room to speak to a doctor, to ask questions, to review the clinical plan, and then another room, which is a typical clinical room where they'll be examined, where they'll have procedures. The separate room, which is more set up like an office, was a great bit of peace of mind for some patients, knowing I'm not going to be touched during this time. There's going to be no procedures here. Nothing's going to happen. I'm just here, fully dressed, waiting, speaking to my provider, and having a conversation. And when I switch to the other room, that's where I have to mentally prepare myself for some things that may be uncomfortable. So that is also another tool that you can use. Questions are key, and allowing time to process information about the care and the procedures that are about to happen are really important. Again, if you have an image of the procedure, or if you have some documentation that a patient can review even prior, it can be helpful. And you can have the patient create a sensory plan during their procedures or visits. So for example, if they're sensitive to loud sounds and there's equipment that will be loud, such as an X-ray, they can have earplugs, they can have headphones, they can have their music set up, things like that. If they're very sensitive to bright lights, you can have them, you can bring sunglasses for them, or have them bring their own sunglasses, so that they can cover their eyes and have less of that irritating light to make the procedure or process more comfortable. For providing care, the user resources you already have. So there are plenty of things in clinics that can be modified to improve the environment. And then in taking care of patients, ensure that the team that is caring for the patient knows of the sensory sensitivities, and encourage them to accommodate as much as possible. If possible, also limit the number of staff so that you can reduce anxiety and additional triggers of multiple people involved and having to go through this process multiple times. If you are lucky enough to have a child life specialist, social worker, or a therapist, a physical therapist, they can get involved in some of these visits to help support the patient. The interaction techniques will be discussed next. So these are the major guidelines for interacting with patients with sensory sensitivity. If you were able to provide a survey or questionnaire, or just a document for patients to say what their sensory sensitivities are, review them. But if you did not, please ask patients if they have sensory sensitivities before you begin, especially a physical exam or any kind of contact. Explain the process that's going to happen in the clinical visit, and maintain space. Make sure that the patient can interact with you, but just give them that certainty that you're keeping your distance until it's time for starting the procedure or starting the physical exam. Allow patients to have time to process what you're saying, ensure understanding by allowing them to ask questions, and again, avoid physical contact until necessary. Once you've decided that you're going to do a physical exam or a procedure, explain what will be done prior to doing so. Even though you explained beforehand, you made sure that they understood, even during the process, you may have to reiterate what you're doing next, what's the next step. You can also explain on the caregiver. If they have a caregiver, you can use another appendage. So if you're going to put a stethoscope on their chest, you can put a stethoscope on their forearm, or on their caregiver's forearm, or on their caregiver's chest, to show them this is what will happen, so that they feel more comfortable knowing what to expect. Once you start, make sure that you move slowly and perform your exams proximal to distal. And then for patients, especially if they're nonverbal, assume their competence. There's some way that they're able to communicate ideally, and in most cases, if not all. And so if they're nonverbal, also ensure a method of communication, such as paper, symbols, iPad, whatever they use to communicate should be a major tool in the examination process and in the clinical process. Also, when you're speaking, use simple phrases and use age-appropriate terms or cognitive-appropriate terms. Get a sense of what will help your patient feel most comfortable if the caregiver is present. Sometimes our patients with sensory sensitivity have things that they do to make themselves feel more comfortable. There can be movements, like they can rock, they can rub their hands, they can, grip an object. If they become fixated on an object or do repetitive movements, as long as it's safe, do not interrupt them unless necessary. This is their way of helping themselves cope with some of the discomforts. And hopefully it's something that you anticipate from your earlier discussion about sensory sensitivity and how they process it. Please notify your patient as soon as possible if they're going to need a procedure that they're not expecting, or if they have to move to another room. And again, for all these interaction techniques, it's to ultimately prevent them to being in discomfort. Some patients that feel challenged or feel uncomfortable may become self-injurious or have fight or flight responses, or they may have a very horrible psychological experience to the clinical encounter and not come back to your clinic. And that's the last thing that we want. So just make sure you keep these in mind when you're going over your patient encounter. Another way to review how to support patients with sensory sensitivities is scramble. So I thought this was kind of cute. If you love mnemonics, if you hate mnemonics, don't worry about it. But scramble, scramble before you see your patient so you don't scramble your visit and have a big issue that you can avoid. And a lot of these just review what we've mentioned before, sensory management to reduce stimuli, communications that are as simple and as clear as possible, reduce the amount of staff, allow for extra time as needed if possible. If extra time isn't possible, see if you can create a second visit or have a follow-up phone call or a phone call before if that will help your patient. Medication reconciliation, which is really going through the list of medications and ensure everything is going okay, that they're taking it well and there's no issues with that. Having sensory support items if available, make sure that you're listening and then making any modifications. So just as in the emergency room where they changed the x-ray all the way to the x-ray room, they changed it to a portable x-ray to make the patient more comfortable. If that's possible, do things like that. For example, if a patient wants to stand while you take their blood, let them stand. If you're able to draw blood standing, you can certainly do it. It's something manageable if you are not familiar with taking blood. But there's different ways that you can take a patient's blood laying down, sitting down, standing up. Just let them stand. If they're more comfortable standing, let them do so. Don't insist that all patients go through the same process that all patients do. If they're sensory sensitive, please try to accommodate them as much as possible. And so here are some additional tools that can help support our patients with sensory sensitivity. So there's something called a hospital passport. This was created by the National Autistic Society, and it was updated in 2022. So this is a passport. It's basically a little pamphlet. It's digital, and also you can have paper hard copy where you go through different aspects of sensory sensitivity and some aspects that providers should have in mind. And this can be filled out and they can take it with them to every visit, or it can be available in the hospitals or in the clinics just as part of the patient's file. So they can fill them out. And so here's some of the prompts: how I experience pain. So if the patient experiences pain in a way that is worth describing, like not just crying, but maybe withdrawing or becoming very silent, it's important to know that. And how do they communicate pain? Are they going to explain it? Are they not going to explain it? Is it very difficult for them? And then some important aspects of what causes them distress and what ways to avoid distress. So there's already resources there for providers to see. Loud noises, strong smells can cause distress, and these are the ways to help avoid this distress so that it can already be accounted for in the visit, can be quite helpful. Other solutions, as I previously mentioned, a patient can benefit from having sensory support objects. It can start with a coping plan, which can include these objects, but the objects can just be available as needed. So for someone that's going through either a procedure, a very sensitive medical examination, or maybe any medical examination, maybe they just don't tolerate medical examinations well, you can encourage a coping plan. So you can talk to them about what helps them to relax. Breathing exercises can be encouraged. You can also help them refocus with some thought exercises, such as saying, okay, let's stop everything. Tell me 5 things that you see right now, and 4 things that you hear, 3 things that you feel, 2 that you smell, and 1 that you taste, just to help them recenter if they're getting very stimulated or overwhelmed by something unpleasant. You can also discuss a code word or gesture that they can use to let you know they're feeling overwhelmed and they need to take a break. So if they say, any word or, the gesture, that you can stop the process. And if you're able to stop safely and discontinue the whole process, and that can also be considered, or in a later appointment. Most sensory support programs do include a sensory box or kit. Many of these tools can be purchased at a dollar store or even stocked by patients who have extra supplies, or they can even leave their sensory support object at the clinic, so it's already always available for them when they come visit. So some examples are seen here in the kit, such as liquid motion relaxation toys. There can be tablets like iPads if you have the funds for that, stress balls to squeeze, pipe cleaners to play with, fidget games, coloring books, weighted lap pads. Really, you can go to a 99-cent store again and buy a lot of these supplies to just stock your sensory box. And then it's not limited to children. Also, adult boxes can be provided, which can include things like warming blanket, pillows to prop them so they feel more comfortable, water bottles, sunglasses, earplugs, headphones. And again, you can also encourage your patients and families to bring their own tools to these visits so that they have something that they're already familiar and comfortable with. Did you know that you can ask an ambulance to approach your location without flashing lights or sounds if you have sensory sensitivity? When you call for care, you can provide this information to reduce the loud noise and the flashing lights that can make a patient very fearful or potentially trigger an uncomfortable aspect of emergency transport. Also, if you're in the hospital or you have a patient in the hospital, you can get an occupational therapist to help modifications be made for sensory sensitivity. So the occupational therapist can walk the patient through all the procedures expected, all the examinations expected, and create a sensory plan and help them to become more comfortable with their sensory sensitivity. So that can be quite helpful. Other tips for providers in terms of presence: really do your best as a provider to reduce items that divide you from your patients, such as screens, like computers or other tools. Really minimize going back and forth. So try to have everything that you need near you so you can demonstrate, you can explain, and you're not bouncing back and forth, which can be anxiety inducing. And then, of course, apply the interaction techniques that we mentioned earlier and modifications as you become more comfortable. Also know that your environment should be comfortable for you too. If you're comfortable, this will add to your patient's benefits and hopefully will bridge into the way you want your patient to feel. Maybe your clinic can be this beautiful minimalistic space with these gorgeous windows and natural light. This beautiful clinic is in Tokyo, Japan, and they have a really lovely setup. It doesn't really even seem like a clinic, but even if it can't be this gorgeous or this minimalistic, you can do your best to reduce things in the environment that can be triggers. Maybe you can provide some blankets in rooms that can be cold, maybe even fresh baked cookies somewhere in the back if cookies are things that your patients might like. But that is a joke. You don't have to provide cookies, but I would love to be your patient if you had cookies in your clinic. So you're here with me at this talk, so allow me to assume that you already foresaw the power of creating sensory inclusive clinical spaces. Additionally, there are benefits that are for providers and patients, and there's no reason why the very space we use to care for patients becomes the reason patients won't receive essential and preventive care. The incredible bonus here is that all patients benefit. So even if you're not sensory sensitive, feeling ill can place you in a sensitive state that will help you benefit from these options. Also, I find most impressive is that these solutions do not generally require a complete rehaul. They may require a little investment of finances, or they can be completely free. How can you go wrong with making a change that's free and that makes patients feel more comfortable and that makes us all feel more comfortable? I don't know. You'll have to tell me, but I think it's a great plan. So here's my most simplified version of creating sensory inclusive spaces, simpler than the lovely originating list or the scramble. If you like simple, I tried to make it as simple as possible and less sensory, concerning as possible. So 3 steps. 1, soothing environment. So create the most soothing environment you can with the resources you have. Please don't try to buy a whole bunch of things or renovate a clinic. First, work with what you have. So try to reduce the bright lighting, lowering the sound if possible, less people, things like that. So that's first step. Second step is to provide tools to help patients when a trigger is present or predictable. So having a sensory box with toys, or having sunglasses, earplugs, headphones available, blankets, food, snacks, and ability for patients to find space if they need it can be very helpful. And then finally, an interaction as a provider, providing clinical care that's soothing, that's calm and clear, and considers a patient's sensitivities and overall provides clarity to methods that you're going to approach, including visualizations, as a lot of patients do benefit from that. So my aspiration is that with this talk, I've made a case for the importance of considering sensory sensitivity, and that I've given you the confidence to create an environment in patient care that supports all of our patients, or if you're not a provider, that you will find a way to feel more comfortable in these challenging spaces. Thank you so much for your kind attention and consideration, and I hope we can look forward to a clinical world which supports all patient needs as central to provided care, and not something we have to learn as we go along. Thank you.
Wow, thank you so much for your presentation and your work in this area. We now have time for questions and answers from the audience, so we can maybe start from those already submitted. Again, please feel free to use the chat box if you have any questions. Maybe I'll start while folks are still thinking. What kind of guided you maybe, or where did your interest lie as you kind of delved into this area? Very unique. And thank you again for the presentation.
Oh my goodness, my pleasure. Thank you so much for having me, and thank you for your interest and your support of all of our communities to get just a better experience overall in life and in our development and all that. I just really respect the work that you all do and the initiatives you support. So thank you for your question. Yes, my original insight into this was while I was training, I did some research on the experience of pregnant mothers with autism spectrum tendencies. And when I discussed with them, when first I found out that the rates of healthy pregnancies were not as expected, even for young women that had no other medical conditions, I was like, how is this possible? Like, let's explore that. And there was data to support that it was really the clinical experience that our moms were having, or our patients that are pregnant were having during the experience, and that it was a lot of this sensory experience. So persons who are pregnant, who have sensory sensitivity, whether prior or if it's developed during their pregnancy, it can be quite severe. They can feel severe pain, severe discomfort, disorientation. It's really shocking how the sensory aspect at play can be quite dramatic, especially in the clinical space. So there are providers doing these really sensitive examinations on pregnant persons and not really knowing that they can't stand the feeling of touch. They actually want to throw up, or they have nausea when they're touched in certain ways, and they're very uncomfortable. So they have to have these uncomfortable exams regularly. They really are constantly a target of questions, and it's all well intended, but they feel some of the pregnant persons with sensory sensitivity feel overwhelmed, and there's really no resources that I found available to support them. And so I did a little bit more research and created a plan to just help pregnant persons with sensory sensitivity. And then I started to learn that this clearly goes beyond a pregnant person. Children experience this, adults experience this, any gender experiences it. Really, many diagnoses may have some sensory sensitivity aspects. So I'm like, oh, wow, we're really missing the mark. In the medical fields, we're not really, I didn't learn this in medical school. I wasn't taught this. I actually found it on my own, and I just really wanted to be an advocate that it's something that we should know about, and how simple it is to support this. Like, it's not that you need to learn a whole system, that you have to buy all this equipment, that you have to learn a new language. It's really simply understanding how someone's senses can really cause issues for them. They could be sensory seeking or sensory sensitive, but just understanding that and how that interplays into medical care is so important, because some patients, they just can't tolerate basic examinations. And if you just acknowledge that and try to help them, they'll do their best to accommodate you, because you're trying to help them. So it's just improving the experience for patients, improving the experience, and having medical care be more effective. That was the biggest shock for me. Like, this is so easy, this is so simple. And some providers that were doing this didn't even realize that they were accommodating sensory issues. They just realized, oh, some patients really like me to go slow. They want me to stay away from them until it's time for the exam. And I was able to interview some other providers and let them know, these are actually sensory sensitive patients. You may not have known that that's something going on, but you've been accommodating them, because some physicians are very in tune to patient needs. They're really analyzing how to support their patients more. So some of sensory sensitive patients go to those doctors, whether or not those doctors know that that's what they're accommodating for.
Thank you so much for sharing that. I know for the sake of time, maybe we'll take one more question. And I guess you talked a little bit about enhancing some of the health workspaces or health facilities to be able to provide some of this care. Do you foresee any inhibitions, right? How receptive have health facilities been? Is this really feasible across, the country or the world to really be able to do some of these enhancements that you mentioned?
Yeah, that's a great question. It definitely, it certainly depends. There are different tiers to applying these supports. So the very basic of just, being aware of it is something that generally is accepted, understanding that that's something that's out there, and then making modifications that really are using resources in your clinic or in your hospital are also easier, because it's not any kind of cost investment. But as far as I've been experiencing, no provider or clinic or hospital space has been resistant. It's just been a matter of training them, finding the time to train them, and sharing with them how much it is a priority. Because we've found that, unfortunately, some providers, whether it be nurses, therapists, doctors, may feel apprehensive, like, oh my gosh, I'm not understanding why my patient is always having a strong reaction, and they're not really asking the questions. So they may, not provide the full care that they would want to, or maybe they would opt out of seeing certain patients if that was an option. And so we want to eliminate that. Like, we want to reduce all stigma and provide all supports. So if we communicate it in this way, where it's just going to facilitate things, people and clinics and providers tend to be quite receptive. So I think it's quite feasible. It's quite practical. It's just a matter of sharing the message with different providers, because again, I wasn't taught this in medical school. Some medical schools are teaching aspects of this, but it's quite a tight curriculum. So there's a lot to teach. And so the emphasis may not be made the way that it should be. And so it's just sharing the message and helping people understand there are different tiers. And if they are asking these questions, they're only going to benefit the patient and improve the clinical experience for everyone.
Thank you so much. Again, this was very, very insightful. Maybe we'll go to the next slide. I know we have a few announcements. We want to invite you all to register and attend our October webinar that will be presented by Dr. Crane. So feel free to register in the link provided in the chat. And again, thank you for attending this webinar. Again, the links for the previous recordings are also in the chat. We look forward to seeing you at the next webinar. And if you have any future questions, please feel free to reach out to us here at AIRP or to the speaker directly. And have a great day.